Well, hello everybody. Here we are for the Corona update, October 28th, and it's a Wednesday. It's my turn for the video update. So I made some notes this week because I feel like there's a lot going on. So county positivity for Johnson County has been creeping up. For several weeks I've been watching it just go up incrementally, just a smidge, every time I look. Every week I write it down, so it's been 4.8, 5, 5.1, 5.3. This morning it was 6.4, and before I got out of the board meeting it was 6.5. So we are experiencing a sustained increase over time. I think the daily cases have gone from 20 positive cases every day to about 27 now in Johnson County. So I just want you to be aware that we're not making any changes to any of our visitation policies right now, but I do want you to be careful if you're out in the community. If you can avoid large crowds like we've been doing all along, if you cannot go to the mall or the grocery store or anywhere that's crowded, that's probably in your best interest. Additionally, the state of Iowa has 71 outbreaks in long-term care facilities right now. None of those are in Johnson County, but 71 is the highest number that we've had so far at any one given time. Perhaps the closest place is the Colonial Manor in Amana, which is a very, very good place, has a 5-star rating on Nursing Home Compare, has excellent staff, and they're in the middle of a very big outbreak with COVID-19. So I don't want us to get complacent and tired and worn down. I know we've been doing this for 8 months, but using our PPE and staying in when we're ill or feeling unwell is our best bet to beating this virus. So keeping it out seems to be what we need to do, because once it gets in, it seems to travel at will throughout the building. So keep doing what you're doing to keep yourself safe, because what you're doing for yourself is impacting your neighbors, and I am grateful for that. I want to take a minute again to commend the staff, all the staff in every level of care, for their commitment to keeping Oakdale residents safe and wearing their PPE and getting tested every week and having that nasopharyngeal swab shoved up their nose and not complaining about it. And I'm very grateful for that. So I just don't think I say enough thanks to them for their commitment to the residents here and each other. So I talked about outbreaks, large crowds. I did want to make special mention that the university changed their recommendations about the face shields. And so, you know, you were wearing a face shield, maybe it's easier for you to talk with those on. It's easier certainly for people to see your mouth move, but the recommendation has changed that a face shield alone is not sufficient. And so if you'd like to wear both, that's fine. If you are only going to wear one, it's recommended that you wear the face mask and not the face shield. That's because the face shield will keep your virus, if you have the virus, contained, but it's open at the bottom. They also don't recommend gaiters or any sort of substitute to a cloth mask, or the staff in the health center and assisted living are wearing the surgical masks like this one. So if you have any questions about that, you can reach out to me, but keep your face shields and wear your face shields when you're out in public with a mask, and that's the best way to protect yourselves. So I just wanted to talk a little bit about that. I mentioned in the family update yesterday, and I'll mention it here, that I am very acutely aware that the holidays are coming up, and that traditionally for Thanksgiving and Christmas, families gather in large numbers or even small numbers to celebrate the holidays. And I am encouraging you not to do that. Initially, I was thinking anything over 10 people was too many, but Dr. Butler said this morning that 40% of the cases are being spread, I think he was talking about in Iowa, by groups of less than 10 family gatherings is what he was talking about. So there is a risk involved that you could be exposed to the virus by someone in your family who's asymptomatic. We can talk more about that. We have some time. It's not even November yet, but I just wanted to put it on your radar screen that maybe we could consider changing the way we celebrate the holidays this year in the hopes that we all get to celebrate them next year. So think about that, and let me know if you have questions or concerns or you want to talk about that some more. Oakdale East, the update today is that we've moved in 5 households, I think, by today. And I think there are another couple scheduled for this week, so that is super exciting. Welcome to the club. It is not the traditional way we welcome new guests, new Oakdale residents to the family, but we're certainly excited to have the buildings open and to start our new adventure with Oakdale East. And so welcome to the family. I know there's a Brittany Spaniel over there I can't wait to meet. I'm not sure about any other dogs over there yet. So voting, I wanted to talk about voting. Don't mail in your votes anymore. You've run out of time for that. If you haven't yet voted, your choices are now to vote in person, to hand deliver your vote to the auditor's office, or there's a nice handy drive-in option that you don't have to get out of your car. So they're being very conscientious and alert to the virus and trying to make voting easy for people in Iowa City. So please, I don't care who you vote for, I do, but I'm not taking a political stand here. Please vote. Every vote counts. The grocery store has changed. I don't know if you read in the memo, but Brianna has moved the grocery store to apartment 322. That is Steve Cuppy's old office. Please check the memo for hours that the grocery store is open. You can go shopping there. That's a great option if you don't want to go to Hy-Vee or Fairway. I'm not sure what the hours are. I think it's 4 days a week. So that's phenomenal. And kudos to Bruce and Brianna for coordinating an Oakdale grocery store. That's a huge benefit to everybody. I might have to take a turn shopping there myself. Last couple things I wanted to talk about are changes to the activity schedule. So David has been working very hard, and we meet regularly, the COVID team, about what we feel is safe to be doing here, group sizes and things. And so last week was the first Hawkeye football game. I know we didn't win, sorry about that, but we did have a little gathering. Up to 60 people is what was approved. I know that seems crazy to some people, but it was over 3 rooms. It was socially distanced, so it was 20 in each room. It ended up being 20, 20, and 10, but spaced out appropriately, and no different than if you were sitting in the dining room having a meal at a table. There were a limit of 4 people at the tables. Everybody did a really nice job. Thank you very much for following all the guidelines to stay away from each other and keep that social distancing. I really appreciate that. So that is what we would consider a safe event, and we will host the football game again. The second thing that we have coming up is the performance, which is next Thursday, 11/5. The space is limited, so you have to reserve your space with David. We're also going to try to live stream the event, but as live stream sometimes doesn't work, we'll do the best we can there. The performers will be screened before they come in. They'll be spaced more than 6 feet away from anyone who chooses to participate in the event, and they are not singing. So there is little risk to the group who chooses to gather for the event. So I want to reassure you that we're making safe choices every day for everything that we're doing. We are committed to keeping you safe, and if you don't feel comfortable going to any event, please don't go. We're trying to get things on the TV for you to feel safe as well. So we're trying to do everything we can to keep everybody engaged and happy. And if you have ideas, David is always willing to listen to ideas to stream on the TV. But again, if you feel most comfortable in your apartment, then that's where you should stay, and we'll try to bring you some fun there as well. I think I've come to my list. I think it's all good news. We are 32 weeks in, I think 33 weeks into this pandemic. We are absolutely looking for a vaccine on the horizon. I can see it coming. They're talking about it all the time. I don't think it'll be in 2020, but I do think it'll be in 2021, early in 2021. We are already signed up with Walgreens Pharmacy and Maine Healthcare Pharmacy to receive the vaccines, but just to get an added comfort level for me, I signed up as a point of distribution with the national vaccine people through the CDC. And so if the national contract with Walgreens or CVS falls through, we'll be provided 2,000 vaccinations. I'll have to figure out, depending on the vaccination that they develop, how to store it, but we will be able to administer it here. So the intention is to give it to the residents and the staff, and hopefully family members if we get enough. So you should start thinking now about whether or not you'd like a vaccine. If you are going to refuse a vaccine, how you will protect yourself from the virus moving forward. And as soon as I get any information about a vaccine, I'll let you know. My meetings with public health continue weekly, and I'll continue to follow all the recommendations and the requirements moving forward. So good work, Team Oak Knoll. Hang in there. We're going to make it, and we're going to be successful. So have a great week, and I'll see you soon. Thanks.